Coronary Angioplasty. The human heart works tirelessly from the moment it begins beating until the moment it stops. In an average lifespan, the heart beats more than 2.5 billion times without ever pausing to rest. The heart is our very own pumping machine which provides the power needed for us to live. The heart is located in the chest and is positioned almost centrally, with the lower part lying a little towards the left. It is made up of 4 chambers, 2 upper chambers called the atria, 2 lower chambers called the ventricles. Take a look at the right and left atria and ventricles. You know the heart supplies oxygenated blood to all parts of the body. Though the heart is built tough, heart diseases do occur quite commonly. The causes may be lack of exercise, high blood pressure, high cholesterol content, improper diet practices, smoking, etc. One of the most common heart diseases is CAD, coronary artery disease. The coronary arteries are the blood vessels which supply blood. One of the symptoms of CAD is angina, caused by insufficient supply of blood to heart muscles. In angina, pain occurs in the chest and sometimes in shoulders, arms, neck, jaw and back. In such a situation, proper diagnosis is required. Angiography helps in diagnosis and evaluation of cardiovascular problems. The doctor may recommend angiography if the patient has symptoms of CAD like angina. The patient has unexplained, new or increasing chest, jaw, neck, back or arm pain. A heart surgery is planned. The patient has congenital heart disease or congestive heart failure. The patient has heart or blood vessel problems or traumatic chest injuries. During angiography, a dye visible to an X-ray machine is injected into blood vessels. The machine takes a series of X-ray images called angiograms. These angiograms help in studying interiors of blood vessels. Angiograms can show how many of the coronary arteries are blocked by plaque accumulations, pinpoint blockages in blood vessels and extent of blockage, evaluate results of previous coronary bypass surgery, assess blood flow through heart and blood vessels. The doctor might suggest coronary angioplasty if medications or lifestyle changes do not help in reducing the effects of artery blockages. Why do arteries get blocked? The arteries may become stiff and narrow due to accumulation of fats, cholesterol, and other material. This accumulation results in plaque formation. The resulting narrowing and stiffness of arteries is called atherosclerosis. Plaques that accumulate in the coronary arteries can cause chest pain, heart attacks, and strokes. Coronary angioplasty or PTCA, percutaneous transluminal coronary angioplasty, is a medical procedure used to open arteries which have narrowed so much that they obstruct blood flow to the heart. Once angioplasty is recommended, preparation for angioplasty is needed. The doctor will examine the patient before an angioplasty and review the medical history. Routine tests like chest X-ray, angiogram, ECG, blood tests might be performed. The patient will receive instructions on diet and medications. The doctor needs to be informed about any allergies, especially to X-ray dye or iodine, and the current medications. How is angioplasty performed? The entire procedure takes 30 minutes to a couple of hours. The patient will remain awake throughout the procedure and is free to ask any questions. Any unusual sensations must be reported to the doctor. A local anesthetic will be injected into the groin area. A small incision is made and a small tube called a sheath will be inserted into the femoral or radial artery. A guide wire is then inserted into the sheath. Aided by X-ray images on the monitor, the doctor threads a catheter over the guide wire into the heart and coronary arteries. A dye is then injected through the catheter to visualize heart and coronary arteries. Using a special type of X-ray called fluoroscopy, the physician can see blockages as the dye moves through the arteries. Once an obstruction is detected, a guide wire is inserted through obstructed area. A balloon catheter is threaded over the guide wire into the obstruction. Once the balloon is positioned in the narrowing of the artery, it is inflated and deflated several times in order to press the plaque back against the wall of the artery. When the doctor is satisfied that the artery has opened, the balloon is removed. This procedure is generally successful and has a low rate of complications. Once the artery is widened, a device called a stent is usually placed in the artery to act as a support. The stent helps to prevent the artery from narrowing again after the angioplasty. It is placed on a balloon catheter and guided to the blockage. When the balloon inflates, the spring-like stent expands and remains in the artery permanently to hold it open and improve blood flow to the heart. A new advancement in angioplasty is the drug-coated stents, also called drug-eluting stents. These stents are coated with a drug which prevents reblocking of coronary arteries. The drug-coated stents have been widely studied in a number of patients internationally. World over, more and more angioplasties are done using these latest drug-coated stents. Once the stents are in place, the balloon catheter is removed and angiograms are taken to evaluate blood flow through newly widened artery. Finally, the guide catheter is removed and procedure is completed. After the angioplasty, cardiologists will take a decision regarding whether or not artery is sufficiently opened. The patient will be taken to coronary or special care unit where he will be monitored for approximately 24 hours. Blood pressure, heart rate, pulse rate, etc. will be checked and routine tests will be done. When the sheath in the groin is removed, firm pressure will be applied to puncture spot by hand or clamp for 20 to 30 minutes until the bleeding stops. A pressure bandage or sandbag will cover the groin area for several hours. The patient is asked not to bend the knee or the hip out the side as it may cause bleeding from the puncture spot. During coughing or sneezing, it is required to press firmly on the bandage with fingers. In case of pain or discomforts, notify the nurse or doctor immediately. The patient can usually go home 1 or 2 days after the PTCA, unless some other treatment is required. Now, we'll see the merits and demerits of angioplasty. The plus points. The patient can return to work and normal daily routine in a week after angioplasty. For most people, coronary angioplasty greatly increases blood flow through previously blocked artery. The chest pain will subside and the patient will have better ability to exercise. Successful angioplasty also means that a coronary artery bypass surgery might be avoided. The minus points. In some cases, failure of PTCA will lead to open heart surgery. Even after PTCA, there is 20 to 30% chance for reblocking of arteries. Sometimes, a second angioplasty may be required. During the procedure, the artery may become more narrowed or even close off. If this occurs, the artery should be reopened with balloon catheter or even immediate bypass surgery may be